very quick introduction. This is Jocelyn, Jocelyn Jiao. She is the co-organizer of our event today and done a great job. It's been a pleasure working with her on the agenda. She's wonderful, wonderful. And she is a very rare bird, and it takes a robin to know a rare bird, but she is, she is a rare bird because she is both a movement disorder specialist and a palliative care physician. So we're so delighted to have her at Stanford and have her here today talking about living your best life with PSP and CBD. Thank you.
Thank you, Robin. Thank you. All right, we're heading into the noon-ish hours, and I want to reassure everyone that, lunch is soon, so I appreciate all of your patience. And thank you for the lovely introduction, Robin. My name is Jocelyn, much like Robin said, and I'm a palliative care and movement disorder specialist here at Stanford. This all makes me especially glad and honored to be speaking with you. This is a group of people near and dear to me. I'm excited to talk to you today about living your best life with PSP and CBD. When we think about living our best life, I imagine that many of us think of scenes pictured here, being surrounded by friends and family, enjoying good food, being active, being outdoors, hiking, enjoying sports, spending time with our children and our parents. Some other things not pictured here might include participating in our church or our faith communities, caring for loved ones, caring for pets, contributing in our jobs or work. These are all things that bring joy and meaning to our lives. As a doctor, I see that unfortunately for some people, illness can get in the way of us living our best lives. Illness can create challenges that make it difficult for us to access joy, meaning, or purpose. These challenges can be physical, they can be psychological and emotional, practical, financial, even existential and spiritual. I'm here to talk more about how we can recapture some of that quality of life, that joy, connection, and meaning, even while living with a difficult illness. Over the course of the next 20 minutes, we will talk about an approach and medical specialty that focuses on making life as good as it can be. Along the way, I want to make sure to answer your questions so that the session is as helpful as possible. So write them down on those green cards, and I'll do my best to address them later. We will definitely have a few minutes to answer your questions today. Today, we will cover the following topics. What is palliative care? How is palliative care different from other parts of medicine? When and how can someone benefit from palliative care? How does palliative care help people live their best life? And what is the difference between palliative care and hospice? So to start us off, what is palliative care? I'd like to get some ideas from the room, and I'll repeat them for everyone on Zoom. What have you heard about what palliative care is? Go ahead and shout it out. Don't be shy. Comfort care. Coordination of care between physicians. Therapy.
Living without too much medicine.
Living without too much medicines, a simplification. Those are all really wonderful and great thoughts and components of what makes up palliative care. And I'd like to start by talking about what makes palliative care different from other medical teams. Firstly, in palliative care, we start with a perspective where we center our attention upon the person beyond. We emphasize the individuality of every person we work with. This is our focus. How do we do that? Palliative care takes a holistic approach to someone's care. We think of the person and those close to them as the center of that care. That includes family, caregivers, guardians, all people who are part of that central unit. We also acknowledge that when someone is living with a serious illness, that there is more than just the physical symptoms. There's more than just the body that can suffer. We know that the mind, the body, the spirit, and the practical aspects of life can all be affected by illness. Unlike a cardiologist who focuses on the heart, or all the other neurologists here who focus on the brain, we don't just focus on a single organ or illness. We focus on the person and all the aspects of life that can be affected. To make sure we address all the components of life that can be affected by a serious illness, we work together as a team. In fact, often you may meet one or more of these team members during your visits. The doctors and the nurses may focus on managing bothersome symptoms and prescribing medications. We also help patients and families with medical decisions and healthcare planning. And we also help coordinate with the other doctors on someone's care team. The social workers can provide emotional support through regular phone calls, video visits, or check-ins. Social work can also provide caregiver support to your loved ones, help get medical equipment, talk through financial concerns, and look for assistance if possible. Chaplains provide spiritual support. They can offer prayers and blessings. They can also help people face their existential concerns, those big questions like, why is this happening to me? Or how do I find meaning now that life looks so different from how I imagined it to be? Chaplains can hold space for those questions, regardless of a person's spiritual or religious background. So far, we've focused on how palliative care is different from other specialties, and I want to go ahead and provide a commonly accepted definition to dig in a little deeper. I'll start by reading the definition, and then we will break down each component. Oh, I completely, sorry. Palliative care is specialized healthcare for people living with a serious illness. This type of care is focused on providing relief from the symptoms and stress of the illness. The goal is to improve quality of life for both the patient and the family. Palliative care is provided by a specially trained team. Palliative care specialists work together with the patient's other doctors to provide an essential layer of support. Palliative care is based on the needs of the patient, not on the prognosis. It is appropriate at any age and at any point in a serious illness and can be delivered alongside curative treatment. One of the first components in that definition is the idea that palliative care is for people living with a serious illness. First off, I would say that any illness that has a reasonable possibility of being life-limiting over a course of years would be appropriate for palliative care. Some examples of illnesses, conditions, and diagnoses that I see in clinic include cancer, heart failure, progressive supranuclear palsy, corticobasal syndrome, multiple system atrophy, Parkinson's, and ALS. In terms of the services that we provide, one of the main ways we can help is to help manage any symptoms that are keeping your life from being as good as it can be. Some of the most common symptoms we work on with patients include physical symptoms like pain, difficulty breathing, muscle spasms, increased saliva, as well as psychological symptoms such as irritability, impulsivity, anxiety, depression, hallucinations, and larger, harder to define problems such as coping with illness, fatigue, low appetite. How do we relieve symptoms? As I mentioned before, we take a holistic or whole person approach, and that applies to managing symptoms. Let's use insomnia or difficulty sleeping as an example. Let's say I'm seeing someone in my clinic who has PSP, and they are telling me that their sleep is getting worse. This difficulty sleeping might be related to their brain sending stay awake signals to their body. It may also be related to that person worrying about their recent weight loss. It might be a side effect of their antidepressant. It might be related to not being able to find a comfortable position in bed due to their back pain. My patient may be so sleepy during the day that they start to feel more socially isolated from the people close to them. When they're staying up at night alone, they may begin to wonder if the disease and everything they're experiencing is a form of punishment from God. To address people's health as a totality, what we can call total health, we consider what's happening in someone's body and also address how the symptom is affecting their life. So our tools include medicines, yes, as well as psychological interventions, integrative techniques such as acupuncture and mindfulness, and addressing spiritual and existential concerns. In addition to helping manage symptoms, we help with making medical decisions. This can include things like advanced healthcare planning. We can help people complete documents like advanced directives and post forms. We also can help with weighing treatment options. This could include things like helping someone think through whether they want a feeding tube, whether it is time for someone to transition from home to a facility, helping families prioritize what's most important in their loved one's care when time is looking short. As some of you likely know, making medical decisions is hard. Making medical decisions in PSP and CBS and CBD when there can be so much uncertainty about the future, when multiple people in one family can have different ideas of what's most important, all of that can make things even harder. This is honestly my favorite part of my job, helping people weigh the benefits and burdens of treatment options within the context of what's valuable to them as people. Palliative care is here for you and your healthcare team when you need it, and that means at any age and at any stage. There is no particular age, diagnosis, prognosis, or treatment plan that makes you eligible or ineligible to palliative care. And it is extremely important to know that we can be helpful along your journey with PSP and CBD. In a typical clinic day, I see patients who have been newly diagnosed, patients who are pursuing treatment, patients who are engaged with clinical trials, and also patients who are just working to live and thrive with their illness and not receiving any treatment targeting their underlying illness. Among palliative care circles, a common saying is that if our services were a pill, we would be the next big blockbuster drug. Part of this comes from the results of a landmark study in the New England Journal of Medicine. This study showed that patients with newly diagnosed advanced lung cancer actually had a survival benefit when they received consistent monthly outpatient palliative care visits. Patients who got palliative care lived an average of 3 months longer than those who did not receive palliative care. Across many studies of patients with many different diagnoses, palliative care has demonstrated consistent benefits for patients and families, including improved quality of life, symptom control, spiritual well-being, psychological symptoms, and satisfaction. And many of these studies have also shown that people engaging with palliative care have fewer hospitalizations, spend fewer days in the hospital, and that there's less burden on caregivers. Many people wonder, when should I ask for a referral to see a palliative care team? I would say if you are living with a serious illness, such as PSP, CBS, or CBD, palliative care could be right for you. We can be especially helpful if you're having difficulty with symptoms, with decisions, or coping. Our team is also particularly helpful if you feel that multiple aspects of life are becoming difficult and your illness is affecting your mind, your body, and your spirit. Many people wonder if palliative care is expensive and who pays for it. Palliative care is covered by insurance like any other medical specialist that someone is seeing. For example, it would be covered just like a neurologist or a cardiologist. Access to palliative care has been improving, thankfully, in California. Certain laws have helped increase access to palliative care by requiring that patients with certain diagnoses who are covered by public health insurance have some way of accessing palliative care. How can you access palliative care? The first step is to ask for a referral from a primary care provider or from a specialist, such as your neurologist. Inpatient or hospital-based teams, including the emergency department, may also be able to make a referral depending on someone's insurance plan. I want to address a very common question that people first ask me when they meet me in clinic. First and foremost, palliative care and hospice are not synonymous, although I will advise you that many people, including many well-intentioned and well-educated healthcare providers, will conflate and confuse the two. So I'm glad you are all here to help get this correct. As we have described already, palliative care is a large and broad field focused on symptom management and helping make sure the care plans focus on what matters most to patients. Again, we are here for people at any age, at any stage, and can be involved in addition to curative treatment. Hospice is a part of the type of care that palliative care providers train in, but it is only a part of what we provide as a field. Hospice care can be a little confusing because the term actually refers to several things. Hospice is often used to describe a philosophy of care. Hospice is also a health insurance benefit that is included in all insurances. And hospice is a set of services that can be provided in any setting, a home, a facility, or a hospital. As a philosophy of care, hospice focuses on supporting patients for whom comfort and quality of life is the highest priority. In providing this type of care, hospice typically thinks about every intervention, lab test, medicine, and procedure, and asks the question, does this actually help the person feel more comfortable? And if it does, hospice will do anything to make that happen. And if it does not, hospice will recommend stopping that test, medicine, or intervention. Again, the philosophy of hospice care is a really good fit for people who want quality of life and comfort to be their number one priority. And that often does mean that people are less focused on pursuing interventions that might prolong life and also the dying process. As a philosophy, hospice also aims to support people in being in the place that's most comfortable for them. And for many people, that happens to be the home. So hospice does everything they can to make people as comfortable as possible while keeping them in the home. And typically they work to avoid going to the hospital. For some people, being in the home is not what's desired, and hospice services can be provided in nursing homes and other facilities. As an insurance benefit, hospice services are covered under every insurance plan. There are regulations and guidelines that hospices must follow. Medicare provides the guideline that patients should have a 6-month or less estimated prognosis to be eligible to receive hospice benefits. The philosophy of hospice is to provide comfort-focused care. Therefore, hospice may or may not pay for certain treatments that do not provide more comfort. Although there are more and more variable kinds of deals that certain hospice agencies will cover and certain interventions that they will cover. So talking with hospice agencies about individual cases, I found is always very helpful, as unique situations happen frequently and everybody's circumstances are different. Hospice as a set of services is very comprehensive. This is a busy slide. I won't cover everything in detail, but I certainly can answer more specific questions about hospice services in the Q&A. Hospice agencies are composed of an interdisciplinary team, much like the palliative care team, and that includes a doctor, a nurse, case manager, a social worker, chaplain, volunteer, and home health aide. Hospice can be delivered and received in the home, in nursing homes, and in specialized hospice homes and houses in some cases. Hospice provides you access to a 24-hour phone line that is staffed by a nurse, and hospices have the ability to send a nurse out to see someone when needed, often that very same day. Hospice will take responsibility for prescribing all medications needed for symptom relief, and they also prescribe and provide medical equipment, including things like a hospital bed, bedside commode, or wheelchair. As we start to wrap up, we can talk about some resources. We are very lucky here in the Bay Area to have a lot of great palliative care programs. This is a map of some of the palliative care programs who are around the Bay Area, and it's certainly not comprehensive. I put this up to show that we are lucky to have such good coverage, including private, public, and safety net systems. For those who are joining virtually, especially outside of the Bay Area, the best way to find a palliative care program near you is to visit getpalliativecare.org, search your zip code, or ask a neurologist for a referral. As a take-home message from today, I hope that you will remember that if you're facing a difficult road, palliative care is here to partner with you to improve your quality of life and to navigate difficult decisions. I put a slide here for people who are curious. The Stanford Neuro-Palliative Clinic is headed by myself alongside my wonderful interdisciplinary specialist palliative care team. Virtual and in-person visits are available to all patients who are connected to the Stanford Health Care system. And like I mentioned before, referrals can be placed by any provider, so a primary care provider or a neurologist. And I put in the specific way to refer to the Stanford Neuro-Palliative Care Clinic at 213 Quarry Road, our clinic. Thank you for all of your kind attention, and I'm happy to take questions until lunch.
Thank you very much, Dr. Jiao. Okay, we have a few questions. Somebody asks about, is palliative care available in HMOs like Kaiser? Do they have palliative care programs?
Yes, I can answer specifically to Kaiser. Kaiser has a great, very comprehensive palliative care interdisciplinary team. A lot of the big, actually HMOs and managed care healthcare systems have recognized that palliative care is really integral to the care of people living with serious illness. And for many reasons, they've prioritized developing their program. So absolutely. I would always say you can visit the getpalliativecare.org website to find a palliative care program near you, or you can even call your insurance to see who's your palliative care provider who's in network with you.
Are there any palliative care resources specific to PSP or CBD?
I think that is an area of growing interest and research. Certainly, one thing that I might point back to would be that I am one of the proud members of the International Neuro-Palliative Care Society. Their logo is on the bottom, and that is definitely one of our main missions, which is to create more community outreach to give more palliative care resources available to people all over the world.
Okay, can you talk about pain management in PSP or CBD? Is that a part of palliative care?
Yeah, so I think there's a lot of overlap between the kind of symptom management that people typically receive with their neurologist and also their cognitive behavioral specialist, as well as their palliative care specialist. So I do think that almost all of these symptoms are best managed by a team approach. Definitely the kinds of symptoms that Dr. Dedeker talked about, especially affecting motor performance, right? Dystonia, rigidity, can definitely present with pain. We know that musculoskeletal pain is the most common type of pain of people living with Parkinsonism. So I think there's a lot of room for exploring particular medications or different kinds of interventions that target that type of pain. And beyond that, a lot of what the movement providers do, their hope with their symptom management is to provide people relief from any kind of discomfort, and that includes pain.
Okay, can palliative care be provided remotely via telehealth?
Yes, absolutely. I would say that every palliative care is a little bit different. Our palliative care program, because we, want to maintain as much access for people who are able to access our team, is, highly, highly virtual. I think 90% of our visits are actually via telehealth. In the Stanford Neuropalliative Clinic, almost half of my patients decide to come to see me in person. So I think it does depend on the provider and the program, but definitely there are virtual options possible if you're interested.
Is palliative care covered by Medicare or most other insurances?
Palliative care, like any other kind of medical specialty, is covered by Medicare and other insurances. So the same way that you would get a referral to see the neurologist to evaluate your Parkinsonism, the same way that you would see your cardiologist to look at your heart rhythm, you can get a referral to see a palliative care specialist.
Do you discuss a feeding tube option with families?
That definitely is a common question and also situation that I run into with my patients living with PSP and CBD and other kinds of atypical Parkinsonism. I think that the risks and the benefits of a feeding tube are things that are best discussed way ahead of time before someone really needs one, because it's a complicated discussion. I think it's a really complex intervention that has an impact on multiple parts of life. So absolutely, that's something that we can discuss in detail in clinic. And I would say that the decision process is different for every individual.
Okay, promise this is not a trick question. Is palliative care available to someone in hospice?
I think that is a good question. I would say for most palliative care teams and hospice teams, because we do aim to provide a very similar philosophy of care that focuses on symptom management, focuses on support for the family, focuses on that kind of holistic picture, that interdisciplinary look at health and illness, a lot of our efforts are duplicative. So often when someone is engaged in palliative care and we decide to enlist the help of a hospice team at home, we try our best to make as gentle and as smooth a transition as possible.
Okay, now this one is a trick question. You wrote this question for others, so I'm going to feed
Great.
it back to you. What about lifestyle changes, exercise, creative activities, socialization?
So I would say, one of the main things that I love to ask people, just as a teaser for everyone, when I meet someone in my clinic, is what brings you joy? What makes your life worthwhile? What gives you strength? What worries do you have? And often in that series of questions, because it's all in the name of really getting to know each other and getting to know, what really makes up someone's, I don't know, inner self and also everything that they do in life. We do talk about creative ventures. We talk about exercise. We talk about nutrition because all of those things are a part of what many people consider to be critical aspects of quality of life. So often the most important work that I do during a day is I talk with someone and their family to figure out like what are the parts of your life in which we can push the needle and we can introduce more joy, more meaning, more satisfaction, and more purpose.